What is antisocial personality disorder and how is it diagnosed? Antisocial personality disorder, ASPD, is a condition characterized by a persistent pattern of disregard for the rights of others, lack of empathy, and violation of social norms. People with ASPD may engage in criminal behavior, lie frequently, and manipulate others without remorse. The disorder can significantly impact relationships, work life, and overall well-being. In this article, we will explore antisocial personality disorder, its diagnostic criteria, and how it is diagnosed. 1. Diagnostic criteria for ASPD. The diagnosis of antisocial personality disorder is made based on a thorough evaluation by a mental health professional. The criteria for diagnosing ASPD are outlined in the Diagnostic and Statistical Manual of Mental Disorders, DSM-5, which is used by clinicians to identify and categorize mental health conditions. To be diagnosed with ASPD, an individual must meet several criteria. Disregard for others. The individual consistently shows a lack of regard for the rights of others, often engaging in reckless or harmful behavior. Deceitfulness. People with ASPD often lie, manipulate, or deceive others for personal gain or pleasure. Impulsivity. Individuals with ASPD may exhibit impulsive behavior, including reckless driving, substance abuse, or risky activities without considering the consequences. Irritability and aggressiveness. Aggressive outbursts and irritability are common traits of ASPD, especially when their actions are questioned or challenged. Lack of remorse. People with ASPD do not feel guilty for harming others or breaking the law. They may rationalize their actions or blame others for their behavior. 2. The role of clinical evaluation in diagnosis. Diagnosing antisocial personality disorder involves a comprehensive clinical evaluation. The clinician will conduct a detailed interview with the individual and gather information about their behavior patterns, emotional responses, and social history. Psychological testing. In some cases, psychological testing or questionnaires may be used to help diagnose ASPD. These tests assess personality traits and behaviors that are consistent with the disorder. Behavioral history. A clinician will also consider the individual's behavioral history, looking for signs of conduct disorder during childhood or adolescence. Conduct disorder is often a precursor to ASPD, with individuals showing aggressive or violent behavior at a young age. 3. The importance of differential diagnosis. It is essential to differentiate antisocial personality disorder from other mental health conditions, such as narcissistic personality disorder, NPD, or borderline personality disorder, BPD, as there are overlapping traits. Narcissism versus antisocial behavior. While both NPD and ASPD involve manipulation, ASPD is characterized by disregard for the rights of others, while NPD focuses more on grandiosity and the need for admiration. Co-occurring conditions. It is also common for individuals with ASPD to have other co-occurring mental health issues, such as substance abuse, anxiety, or depression. These conditions must be carefully considered during the diagnostic process. Key insight. Antisocial personality disorder is diagnosed based on a thorough clinical evaluation and adherence to the DSM-5 criteria, which focus on behaviors such as deceitfulness, impulsivity, and lack of remorse.